which keeps our waste out of any landfill and advocates for best practices in reducing carbon emissions. This presentation is part 3 of a 5-part process to develop an adaptation guide for the Monroe County healthcare community. There was an inventory of practitioners conducted, which included allopathic and alternative therapy practitioners, a survey of perspectives, this presentation, and its follow-up survey, all of which are contributing to the final product of a tailored guide with recommendations for the healthcare community. Just a few housekeeping items. All attendees will be muted during the presentation. I will unmute participants as you raise your hand during the discussion slides, and we'll take any additional questions or comments either at the end or via email. Please note that the webinar is being recorded, and additionally, I would like to apologize ahead of time for any noise interruptions. There is a naval air station not far from here, so I may need to pause at some point to avoid that interruption. The main learning objectives of this presentation on weather-related health impacts are as follows. Impacts can be direct or indirect. Tools and data are available to help us understand potential scenarios. A population's vulnerability to weather-related health impacts is an intersection between hazard, social, and medical risk factors. These impacts are based on relationships, and planning and preparedness promote resilience. Adaptation is a viable preparedness tool. There are changing elements of our climate. Those changes manifest in the environment of the human family, and human health impacts can manifest as a result. Weather-related health impacts can be direct, such as drowning related to flooding, heat strokes related to prolonged periods of extreme high temperatures. More frequent extreme weather events such as algal blooms are associated with more frequent and more severe asthma attacks. More frequent and more severe extreme weather events such as tidal surges, tornadoes, hurricanes, and superstorms are associated with injuries to human beings, in addition to increased occurrences of both loss of life and property. More frequent periods of extreme heat can produce greater amounts of both loss of life and property. More frequent periods of extreme heat can produce greater amounts of unabsorbed cancer-causing UV radiation. Weather-related health impacts can also be indirect, including mental and behavioral stress related to the loss of property, loss of economic opportunity, or even displacement and upheaval, including homelessness. Increased prevalence of respiratory diseases such as COPD, asthma, and heart failure are associated with extreme weather events such as more frequent and longer lasting periods of extreme heat, tidal surge, or precipitation. Changing air and temperature ranges are producing new ranges for vector-borne diseases, including some tropical diseases which are presenting in temperate zones. As a result of the expansion of the warming seas, sea level rise is threatening underground freshwater supplies in many coastal communities, including those in South Florida. This type of intrusion can affect water use for municipal drinking supplies as well as that used for agriculture. The same process also threatens agriculture in South Florida communities by attacking the roots of crops planted in the thin layer of muck covering the limestone rock, which is the foundation for much of the region and allows seawater to seep far inland. Waterborne infections such as Vibrio and Giardia also increase in prevalence in the face of increased likelihood of standing water and warmer water temperatures. Weather variability and extremes impact health resources through relationships. For example, extreme weather events can damage housing infrastructure through high winds and through standing water associated with flooding and surges. Mold from saturated flooring, walls, and roofing aggravates existing respiratory health challenges and can trigger the onset of new respiratory responses and conditions through regular long-term exposure in the home. Recent decades of warmer air have caused conditions which prevent the refreezing of some mountaintop glaciers, which in turn cannot melt to produce water supplies for communities at lower altitudes. Salt water seeps into groundwater storage areas as sea level rise and threatens urban and rural drinking water supplies in many coastal regions, such as Broward County, Florida. Saltwater intrusion and changing vectors for agripests threatens the reliable productivity of many agricultural regions, impacting food security. According to a 2012 statement from Mr. Charles LaPrade, Agricultural Manager of Miami-Dade County, 2 to 3 new agripests are introduced into the region each month through the Port of Miami, many of which will thrive in their new environment, promoting hostile conditions for agricultural crops. Hospitals in Monroe County, Florida, are built according to county code above sea level and the floodplain. However, regionally accepted predictions of a sea level rise of 3 feet by 2060 put the roads leading to those hospitals underwater. Extreme temperatures negatively impact respiratory patterns. The acceleration of change denies us the biological adaptation of evolution and requires sociocultural and intellectual adaptation to our environment. Planners use models or scenarios to predict outcomes and plan responses to changes in community environments. One such planning tool has been developed by the Nature Conservancy and can be found at coastalresilience.org by clicking on the Launch Mapping Portal button. This tool looks at vulnerable areas of the United States, including Monroe County, listed as the Florida Keys. The blue lines on these maps indicate which roads will be underwater at 9 inches of sea level rise by 2060. The red lines indicate which roads will be underwater at 24 inches of sea level rise by 2060. The regional compact counties, including Monroe, have agreed on a regional expectation of 1 to 3 feet of sea level rise by 2060. The question now is not if this is going to happen. The questions now are when and how much and how will we respond. Standing water can result from excessive rain and on otherwise dry days from tidal surges pushing seawater and groundwater up through sewage and drainage systems. This can leak contaminants into and out of systems and cause saltwater intrusion, in addition to the impacts the resulting standing water can have. These same processes pose an additional threat by creating new and more extensive breeding grounds for vector-borne diseases such as dengue and waterborne infections such as Vibrio. In Monroe County, exposures to these processes can occur in the home, the workplace, and in businesses. Bacterial infections can also result from contaminant exposure related to standing water and sewage backwash, as well as respiratory conditions related to mold. Social and medical vulnerability are also important in understanding a community's potential for risk and addressing risk. Factors such as age, population density, access to cars or shelters are the factors influencing social vulnerability. The burden of disease, the availability of providers, the number of special needs persons, and the locations of hospitals impact a community's medical vulnerability. Vulnerability is the risk a community can expect with regard to the likelihood of impacts and the consequences of those impacts. Hazard vulnerability references a community's level of risk for particular hazards, such as sea level rise, frequent or severe storms and storm surges, or prolonged periods of drought, and may be related to geography or geology. These factors and their intersections serve to protect against or increase vulnerability risk in communities and populations. Resiliency. Resiliency requires an understanding of a community's vulnerability and is based on planning for expected outcomes and anticipating unexpected outcomes. It considers how social and medical vulnerability intersect with hazard vulnerability or exposure to risk. Resilient communities are prepared to protect slightly vulnerable areas, to retreat from overly vulnerable areas, or to accommodate changes within an area. With regard to health impacts, preparedness and planning are essential to sustainability. Population health is intricately linked to the natural and built environments, and while weather impacts can be direct, communities are also vulnerable to indirect impacts, which may take longer to manifest and require greater foresight to address. According to Professor Emmerich of the University of South Carolina, a one-size-fits-all strategy ignores the reality of social inequality and the nature of the driving forces that reduce resilience. For example, Monroe County, Florida, is designated a health professional shortage area by the Health Resources Administration, or HRSA, for mental health professionals. The long-term impacts of extreme weather events are not yet fully understood, but additional mental and behavioral health professionals on call or as a regular part of the community can promote resiliency and protect against some of the negative consequences of post-disaster stress. Consider contingency planning or continuity of operations planning to be a #1 key to the sustainability of your practice and the health of your patients and clients. In Monroe County, there are no services available after a Category 3 or higher storm until the county is reopened by emergency management. Emergency management sends teams throughout the county to determine if and when it is safe for residents to return. Once they do, the process to return to normal is the continuity of operations plan. After a storm or other extreme event, what will you be prepared to do to provide a continuum of care for your patients? How will you get back up and running? How will you continue operations? The Interagency Working Group on Climate Change and Health in 2010 identified 11 health effects due to climate change as listed on the slide. Each of these is impacted in some way by environmental factors. The collection of past and current health data, particularly health data related to environmental conditions, gives us a picture of where we are now or a baseline of comparison as we plan for regional changes. Planning by the Southeast Florida Regional Climate Change Compact counties of Broward, Palm Beach, Miami-Dade, and Monroe, inclusive of this baseline health data, can guide policies which protect and assure the conditions of public health. Counties within the compact are incorporating climate change and energy elements into their short and long-term planning documents. The Health Impact Assessment conducted by the Florida Institute for Health Innovation, formerly the Florida Public Health Institute, aimed to prepare those counties to be inclusive of health data and health impacts in those planning documents. The Health Impact Assessment of the Compact's Regional Climate Action Plan in 2014 found that of the 11 climate change-related health consequences identified by the Interagency Working Group, 5 particular conditions are expected to impact Monroe County, Florida. The Health Impact Assessment was designed to provide the Compact with a framework for including health impacts in its planning paradigm. So, while prolonged periods of high heat or extreme low temperatures are not expected to be problematic in Monroe County, standing water and sea level rise are expected to have health impacts in the county. At this time, I'm going to unmute everyone. The group is not that big. We have about 12 participants, so I'm going to unmute everyone and open up for discussion. Let's see, that's mute all. Unmute all. Okay, so I thought I could easily one at a time. I said I have to do it.
Thank you so much. All right, take care. All right, bye.
So I have everyone is unmuted at this time so that we can have some discussion. I'd like to engage you with a couple of questions. At first, I'd like to talk about community health workers. Community health workers are recognized as a critical part of the healthcare system. Community health workers are lay members of the community who work with the larger healthcare system and usually share cultural, linguistic, or socioeconomic experiences with the population in which they work. How could community health workers be utilized to address the concerns identified by the Health Impact Assessment for Monroe County? Just as a reminder, the Health Impact Assessment identified asthma and respiratory problems, foodborne disease and nutrition, mental health and stress disorders, vector-borne and zoonotic diseases, and waterborne diseases as primary concerns for Monroe. Community health workers, again, they do engage with the community directly through shared economic experiences, perhaps a linguistic bond or a cultural bond, and are often privy to more information than a healthcare provider because of that personal connection. It has been suggested that community health workers, because they do have oftentimes a more personal access with a patient or a client, if a respiratory condition has been detected in a family, for example, a doctor or a PCP, primary care provider, may write a prescription for a home health assessment. The Department of Health can do things like home health assessments. Someone like a community health worker could then be engaged to explain what it means, the information found in the home health assessment, what that means to the person's health or to the family's health. That's one way that community health workers might interact with the community to better understand how an individual's life or their environment or their lifestyle might be impacting their health, and help that individual to understand how they make changes, or help the provider communicate better what sort of recommended changes might be available to improve health for that family or individual. Does anyone have any other suggestions on ways that community health workers might be utilized to engage patients, clients, or populations regarding the concerns identified in the health impact assessment. I've got somebody doing a lot of typing, and if you wouldn't mind to please mute your line. I don't know exactly who that is. Maybe I can see. Okay, so let's go on to the next discussion question then. Are there other health impacts not mentioned which should be considered in Monroe? Again, the health impact assessment is targeting waterborne disease, vector and zoonotic diseases, mental and behavioral stress, foodborne disease and nutrition, and asthma and respiratory problems. Are there other problems we might see in Monroe manifesting based on weather-related health impacts? Injuries are a very big concern within Monroe County. So of course injuries are going to be a part of that. Injuries related to standing water as well as to high winds, related to high winds. Our last discussion question, if anyone has any input for that, we actually have a visioning question here. What information do you or your clients, what information do you or your colleagues need to prepare and adapt to anticipated hazards? What do clients and patients need? What would a resilient Monroe County look like? Do we have great strength? Do we have a major weakness that we're not thinking about or that we are thinking about? I'm going to go ahead and just leave that up there for a minute in case anyone thinking about these concepts comes across an idea that they'd like to share. Since no one really has much to add or engage at this point, I'm going to go ahead and mute everyone again and move on to the responses that are currently in process here in Monroe County or in South Florida in the region. South Florida is responding and preparing. The slide provides an overview of some of the regional efforts. I am currently or have been in the past an advisory or steering committee member on all of these response activities except the Southeast Florida Regional Climate Compact. BRACE, Building Resiliency Against Climate Effects, is the work of the Florida Department of Health and county health departments, as well as a number of collaborative partners. It is a statewide, localized program with advisory members from a variety of disciplines and backgrounds, which serves to develop ways to anticipate health effects by applying climate science, predicting health impacts, and preparing flexible programs. BRACE examines health impacts and potential responses related to drought, hurricanes, extreme heat, flooding, wildland fire, and sea level rise, among other climate events, through a 5-part framework. The Southeast Florida Regional Climate Compact is hailed as an example of regional collaboration. Founded in 2009, the compact came about when all 4 counties saw the need to respond and saw that their responses would need to be aligned in order to be successful. The Health Impact Assessment. Public health leaders recognized the relationships between policies and community health, and it was noted that health effects were not part of the climate conversation in the regional efforts, or at best were limited to side discussions. The Health Impact Assessment determined the impacts of the recommendations of the plan as related to health and made recommendations of its own based on to be adopted into future plans. The work of the Kresge Grant further explores impacts in the region and aims to produce community tools for planning and preparedness as related to sea level rise. The Monroe County Climate Change Advisory Committee consists of 2 appointees from each of the county's commissioners, 1 appointed from within their district and 1 from the community at large. This volunteer committee advises the Board of County Commissioners on climate change related items. The Marshall Foundation for the Everglades, Earth Learning Miami, Florida International University, the University of Florida, South Florida Regional Planning Council, and many other local partners are also responding every day, from catching rain to growing food and biking to work, to writing to Congress and marching in Tallahassee. There are a number of resource documents and websites available to explore this topic further or to understand in greater detail the related concepts. Many of those resources are .gov, such as data.gov/climate, coast.noaa.gov, or toolkit.climate.gov. You'll also see a link here in the resource list for a YouTube video. This is the President's Earth Day 2015 discussion at Howard University with the Surgeon General and other community members. And actually, the President could have given you this presentation today. President Obama is a strong supporter of place-based initiatives. His administration has hailed the Southeast Florida Regional Climate Change Compact as an exemplary model of regional collaborative planning. Many available resources are local or regional in focus, such as the website 750.org, which outlines a 7-county, 50-year planning agenda for a sustainable Florida. The Southeast Florida Regional Climate Compact's Adaptation Action Area Planning document found on the Compact's website is also a great resource. The Health Impact Assessment Report found at the Florida Institute for Health Innovation's website under the Projects tab, and the Monroe County Climate Action Plan are also available for guidance. I'd like to take a moment to acknowledge and thank the funders of this work. This project is supported by the Florida Department of Health, Bureau of Epidemiology, in cooperation with the U.S. Center for Disease Control and Prevention. We face real challenges and need to address real changes living in Monroe County, Florida. I've found that public health and climate change advocacy link together the importance of strengthening communities, empowering local leadership, and bringing sustainable living to the everyday conversation. Planning and preparedness are vital because education and networking are the keys to moving toward a sustainable future. The link on this screen will be sent to you via email following today's presentation. And please follow it to complete a short evaluation and provide a valid contact in order to be entered into a drawing for a $200 Wells Fargo Visa gift card. I'm also going to put the link in the chat box so you can cut and paste from there if you'd like, if you would like to do that before the email arrives to you. ADAPT. Okay, so that is also available in the chat box now. Now it is. And you just want it to be known, your responses will be used to provide feedback about today's presentation and to inform the forthcoming Monroe County Healthcare Community Adaptation Guide 2015. Thank you all. I am deeply honored for this opportunity to talk with you today. I hope you will consider sharing this knowledge and applying it to your plans for a future in Monroe County, Florida. The adaptation guide, which will incorporate any feedback provided and offer targeted adaptation recommendations for the healthcare community, can be expected this July. On June 15th, 2015, the Monroe County Climate Change Advisory Committee will be hosting a workshop and featuring guest speaker Karen Bolter, PhD of the South Florida Regional Planning Council and Florida Atlantic University. This meeting is open to the public and will be held in the Marathon BOCC Chambers in the Marathon Government Center at 12:30 p.m. Again, that's June 15th, 12:30 p.m., the Marathon Government Chambers for the Monroe County Climate Change Advisory Committee meeting and guest speaker series. On August 1st, 2015, the Marshall Foundation for the Everglades in Palm Beach will host its annual Sea Level Rise Symposium. This year's theme, Solutions for 21st Century, is co-sponsored by the League of Women Voters of Palm Beach County and the Youth Environmental Alliance at Oxbridge Academy. Additionally, in December of 2015, Monroe County will host the Regional Climate Summit. It will be held December 1st through the 3rd, 2015, at the Casa Marina Resort in Key West. This concludes today's webinar. My contact information is available on the screen if anyone would like to reach me directly. Also, if anyone has any questions, please feel free to ask them at this time. And I thank you all very much for your time and attention. Have a great day. Doesn't seem that there are any questions, so I'm going to go ahead and log off. And again, I thank everyone for joining us today. Please do complete the evaluation found in the chat box, and you will receive that evaluation link via email. A recording of the presentation will also be available. Thank you.